The surgical consent is a means to help inform the patient about the surgery, the preparation for surgery, as well as the expected post-surgical course so that you can make an informed consent in proceeding forward with surgery or finding an alternative solution to your condition. Thyroidectomy is the term for surgical removal of the thyroid gland. Varying amounts of thyroid gland can be removed. A person has a left and a right thyroid gland joined in the middle at the isthmus. The thyroid gland's function is to regulate metabolism such as heart rate, fluid balance, energy level, and brain function. There are many reasons that a person may require removal of a thyroid. The function may be altered in a manner which is not controlled successfully with medication. There may be a cancer in the gland or areas which are worrisome for a cancer. The gland can also be enlarged, such as swallowing or breathing can be difficult. Thyroid surgery is technically demanding and has many important elements that need to be understood for you to give an appropriate consent. The operation is typically performed under a general anesthetic in which the patient is completely asleep. The details of the anesthesia will be discussed by the anesthesiologist. The administration of anesthesia involves serious risks, most importantly a rare risk of reaction to medication causing death. Please have a list of questions for your anesthesiologist to discuss prior to surgery. Any operation has the risk of infection, bleeding, blood clots, nerve injury, heart attacks, allergic reaction, and pneumonia. These risks can be serious and even fatal. The requirements for a transfusion is exceptionally rare and will be discussed in the hospital's consent forms. For thyroid operations, an incision is made in the lower neck and will leave a small scar. The muscles of the neck are separated without cutting them in order to decrease bleeding and optimize recovery. All or a portion of the thyroid gland may be removed, depending on your specific problem. Sometimes only half of the gland is removed so that the remaining half is functional to avoid requirement of supplemental thyroid replacement. If the operation is performed for cancer, total thyroidectomy is usually recommended. The thyroid will be separated from the windpipe and the voice box. During the operation, it is necessary to identify and protect the trachea, the recurrent laryngeal nerves, and the parathyroid glands. The parathyroid glands are often attached to the thyroid glands but have an entirely different function. Disruption to the blood flow of the parathyroid glands may lead to low calcium and symptoms for low calcium. This is usually a short-term problem for less than 1 week, but could remain a long-term issue and require daily supplementation with calcium. Additionally, the nerves controlling your voice box will be identified and protected to the best of my ability in order to preserve your normal voice. A significant nerve injury can cause permanent voice hoarseness and weakness. Vocal cord paralysis is rare, but requires voice therapy. For a brief period of time, it may be difficult to swallow liquids. Your singing voice can become permanently altered. In extreme conditions, the airway can close in such a manner that a temporary tracheostomy may be necessary. In extremely rare conditions, this can be permanent. If abnormal findings are identified during your surgery, such as enlarged or abnormal lymph nodes, then a choice will be made to remove one or all of these abnormal structures. Once the thyroid gland is removed, your neck will be closed in layers to include both muscle and skin. Some very large thyroid glands require a larger incision and may require a plastic drain, which is usually removed the following morning. You will have a small scar in the base of the neck, which tends to blend in nicely over time. Sometimes the scar may heal adversely and need further treatment to help it become less apparent. All removed tissue is examined by a pathologist to identify and characterize any significant abnormalities. Within 7 to 14 days after surgery, I will go over the pathology report in detail with you in my office. To summarize, complications are uncommon. These include extremely low calcium that causes cramping and requires hospitalization for IV calcium supplementation. Injury or stretching of the nerve to the voice box can cause hoarseness. This is usually temporary, lasting for several weeks. The risk of bleeding is real and is what leads us to observe the patient in the hospital overnight. If a bleed occurs, then it will be necessary to take you back to surgery to explore the wound, remove the blood clot, and look for the bleeding vessel. If all your thyroid gland is removed, you will require thyroid hormone therapy by mouth. This requires periodic testing to assure that your thyroid levels are acceptable. This medicine is taken daily and for the remainder of your life.